thank you, governors, for coming. See, Utah and Mississippi both run about a $700 million deficit right now. That's what I'm being told. Where Massachusetts has a $1 billion deficit. You all have balanced budget amendments. And Illinois is $13 billion in debt. That's our financial position in the state of Illinois. If members of the congressional delegation would write you a letter saying, hey, Governor, we know you got issues. Can you get with your health and services people and let's start talking about how we can jointly help solve this problem? Would you, as a governor, be open to a letter by members of the congressional delegation to address your concerns? Governor Herbert?
Absolutely.
Governor Patrick?
Well, I'm not sure I understand the question, but we've been working closely with our delegates.
Well, this is Medicaid. We have a large role in the Medicare delivery system. We are partners with you. If your members of Congress said, we want to help you, would you say, yeah, come on,
I've
help
never
me?
said no when our members of Congress
Thank you.
said
That's what I...
Yeah, that was the answer, yes. I think, to her credit, Christine Gregoire, who's the chairman of the National Governors, a Democrat, by the way, is trying to do just that. And the fact that y'all are having governors here is encouraging.
Just for the record, in November 2009, we sent a letter to our governor, and we have yet got to get a response. One that has $13 billion in debt based upon Medicaid. I'm going to address some really quickly cost issues. If we're going to try to help contain cost, EMTALA, which is the emergency room law that anyone who walks in the door has to be received, even though it's not an emergent issue. If we addressed EMTALA and we're able to triage and push people to urgent care, that would be a reform at the federal level. Would that help you control cost?
I think it would. It needs some analysis by experts in our state, but I think so.
Governor Patrick?
Yeah, I think it could, and we've been taking those very steps.
Yeah, it's great.
I would urge it to give us permission for us to do something rather than telling us how to do it.
Great. What about Obamacare had, when we're talking about saving costs, it was $50 billion of savings if we would move on tort reform. Lowering costs, $50 billion, which could have gone to pay some of the expensive costs of promoting it. Would tort reform be a good way to hold down costs, Governor Herbert?
Absolutely.
Governor Patrick?
In the bill I referred to earlier, which is our next phase of health care reform, we have included tort reform in that, yes.
My first year as governor, we passed the most comprehensive tort reform in the country. It doesn't just help cost, it improves the quality of care because we had doctors leaving to get away from lawsuit abuse, and so it is more than cost.
Last question. Under on federal law, we give in federal qualified health clinics, we give them Tort Claims Act protection. If we're providing health care, Medicaid dollars, federal dollars, if we provided federal Tort Claims Act protection for practitioners who are receiving federal dollars, would that help drive down costs, Governor?
I think so, yes.
I don't know how to answer that.
Well, it's a tort reform issue, so.
Under our state Tort Claims Act, the university hospital and all, they have caps under the law, and it does help.
Thank you very much. Yield back my time.